Hey, deserving listeners, a lot of you know that I recently published an episode in which I interviewed a minor attracted person, a non-offending minor attracted person, or a no-map, N-O-M-A-P, named Jay. He wanted to be on the show to spread the word that not all minor attracted individuals are offenders. It was a pretty interesting interview. It went into a lot of different areas, his own traumas, this kind of thing. And one of the listeners out there, Paula, actually listened to the episode and said, hey, I have a colleague who is someone who specializes in treating sex offenders, and so you should have her on the podcast. So that's how you're on the podcast, Casey. Welcome.
Hi, thank you.
You're a licensed professional counselor, which is master's level clinician. You also have another credential, which is a sex offender treatment professional. Tell us about how you gained that credential.
Yeah, so after I got my master's, I worked a lot with like children and things like that, and people who had been abused by individuals. And throughout like working with the system and learning about that, I learned that people in the system also have high like trauma histories. And I was interested in working in the field of more forensic work anyways. So I kind of looked into that and decided to do a lot more training. You have to work an extra 1,500 hours with individuals who have been charged or convicted of sexual offenses or have problematic sexual behavior. So again, not somebody who like actually offends, but is thinking about it. And then a lot more training. So that's that credentialing outside of the LPC.
And supervised, I'm guessing, by another SOTP?
Yes, supervised as well. It is like becoming something that more people are interested in. So that's nice.
Why do you think that is? Why do you think people are more interested in it?
I think because there's more education around individuals who've committed sexual offenses, that we see that treatment and therapy is actually a huge boost for helping people not recidivate. And I think people are like, oh, they're like the less of the stigma and things like that. And they're actually able to use like clinical skills and less punitive measures. And it's not a one size fits all kind of thing. So I think there's more clinicians interested.
Not only recidivation, but also committing a crime in the first place, right? If we can reach out to people prior to committing a crime, we could maybe prevent people in the beginning. I mean, have you ever had someone like that, like a teenager or a young adult come to you and say, I'm struggling with these urges, I need help to prevent myself from even beginning this sort of thing?
I would say like more so over the past 5 years. Prior to that, we didn't really have a lot of people reach out to us because there is such a huge stigma and, of course, mandated reporting laws. They're afraid. They're like, if they say something, even if it's not necessarily like a hands-on offense or anything like that, that they're going to get reported. But now I see there is a couple more. I think I only have like in our whole agency, a couple people in our agency who came in who have not offended or are thinking about offending.
So what's the percentage then of your clients that come in that have never offended or claim to have never offended?
Probably like less than 5%. I wish it was more. We definitely wish it was a lot more.
Yeah, I mean, the hope is one day that it'll be like 90%, right? Hopefully we're heading in that direction because we've been working so hard as clinicians and also activists like Jay, who wants people to understand that there are non-offending minor attracted people, trying to raise awareness, lower stigma so that people can get the help that they need. So you mentioned that there is mandated reporting.
Yeah. So if they have like plan or intent, of course, of like harming children, elderly, animals, we have to report for that as well. If we know that these individuals are in care of children and have plans or intent, we have to report. If it's just a thought, we don't necessarily have to report that. But if there's any indication that any harm can be most likely be done, we have to report that.
So what would be the threshold there? Someone comes in, they've never offended, for example, if we just go with that example, and they have nieces and nephews, maybe they don't have any of their own kids. They're 25 years old, 30 years old. They don't disclose they've looked at any kind of child pornography. In your interview with them, they claim that there's no risk, there's no plan to harm the children that they might see on the weekends or on holidays or something. Maybe they live within a few blocks of an elementary school just by coincidence. What's the threshold? What are you looking for that would require a report?
Yeah, that we definitely wouldn't report. I guess if they said like, hey, I actually feel like I can't control my impulses. I think I'm engaging in grooming behavior, especially with nieces and nephews kind of following that like pattern. But if they're not like reporting any of that stuff, or if that's stuff that we can work on in treatments or therapy to help reduce, then we definitely can stop that. But we know through a lot of like research and things that individuals who have some sort of interest or attraction to children aren't typically or don't always are the ones who actually have those sexual abuse histories towards children.
Mm-hmm. So when you tell people at a dinner party what your career is, what do they say?
Mixed reviews. But I definitely think like educating them, like this is also helping keep the society safe. It's like helping keep individuals or helping them with sexually problematic behaviors. Because again, the vast majority of my guys, if they go through treatment successfully, are very highly likely not to reoffend again. So just really helping them, like working like it's therapy. It's human beings who made a pretty big mistake that did harm another individual, but typically it's at one time.
It's a public good that you're doing, and it sounds like you have to explain. So what myths do you think people are often operating from when you have to somehow because dentists don't have to justify their careers at a dinner party. What myths are people operating from?
I think that all these individuals, or the majority of these individuals, are like people are hiding in bushes looking for children, or hiding in bushes looking for women, and that they're monsters or sadists, which is not the case. These are typically, who's your abuser is. So it's typically not a stranger. I think there was a research that came out that it's like 93% of sexual abuse cases, I think it was in New York State, knew their abuser, and only 7% was by stranger, especially with like media and like all these true crime TV shows and like the popularity of true crime stuff. People think they're just like these sadistic monsters, which they're really not.
Mm-hmm. So I was asked by a lot of fans to watch the new Netflix series about Jeffrey Dahmer. Have you seen that series?
Yeah, I have. Yeah.
Given your work, what did you think about while you're watching it?
It's another series that hopefully isn't like hurting victims' families or anything like that. But I found it very interesting how they kind of portrayed like the racial components as well. But it was an interesting show in regard to like some of his aspects, especially when he was a child, kind of showing that. And it sounded like he wanted to stop as a child as well. So it's good to kind of see that.
So when you're watching that, are you thinking, if only our society was different so that Jeffrey Dahmer could have found someone to talk to, a lot of lives could have been saved?
Possibly, yeah.
So earlier you said your guys. Are you saying that all your clients are men?
The majority, I would say, throughout my career, I've worked with 5 women, but mostly adult men is who I work with. Not a lot of women.
Are there any differences gender-wise when it comes to presentation and treatment?
Yeah, so a lot of times when it comes to women, the research shows that treatment isn't necessarily indicated. There's tons of other factors that are at play when it comes to women who sexually abuse, because a lot of it has to do with like there's a co-defendant involved with women, or it's high trauma. Of course, anybody involved in the system has a higher likelihood of having trauma, but with women even more so.
Okay.
With women, just like kind of like the monitoring, they're less likely to reoffend. Recidivism rate is very, very, very low. I think it's like 1.6%, but I would have to look that up. And it's more mental health based. For men, we definitely want to do more of those like dynamic risk factors. Those are more heavily identified in men that sex offense treatment can provide. Whereas that's not necessarily the motivating factors behind why women offend sexually.
Interesting. So if they're not enmeshed in a relationship with another offender, then they're less likely to offend on their own.
Mm-hmm. And there are some cases where women need SO, like sex offense specific treatment, but very, very rarely.
Why do people commit these crimes?
I believe it's like very contextual. A lot of times, I would say in my experience, the majority of my clients, it seems, are in a relationship or in a lack of relationship, having issues connecting with somebody, struggling heavily with social skills. Typically, we're not going to engage in risky behaviors if our life is great, right? We're going to be in probably a shitty kind of life situations. And then we're more likely to lead into like these cognitive distortions or thinking errors where we are justifying acts to get these needs met. So it's not like all of a sudden somebody's like, oh, I'm going to abuse somebody sexually to get these needs met. It's something over time where they're slowly justifying. So for instance, if we like a case of a stepdaughter or something, he's not connecting with his wife. He's not having any ways to get his sexual needs met. He's having issues at work. He starts seeing his maybe 15-year-old stepdaughter more sexually. She's curvy. She's apparently flirting with him, things like that. He's starting to justify that behavior to be able to groom or just act sexually with her. Those are typically the things that I see.
Alcohol use, drug use.
Substance use can definitely be a part of it. Absolutely. That's more of the, like, we see more of the impulsive behavior come from if they're abusing substances. Absolutely.
So that's a lot different than I think what people typically think of offenders, where they're compulsive, they can't control it. They wake up in the morning, this is what they want to do with their life. Not a symptom of suffering in life in general. Because of course, most people wouldn't do this sort of thing, even if their life was a problem. So is it just that when they're struggling with life, it's harder for them to sublimate their needs or control their impulses? Is that the way of thinking?
Yeah, or like they didn't have a lot of like sexual education growing up. There is, of course, like I have some on my caseload who have more problematic like paraphilic preference or things like that. But again, the majority don't show any evidence of having like pedophilia, hebephilia, anything like that. It's just those circumstances. Definitely a lot of intimacy deficits is the biggest thing I see. And I work now a lot with like adult only offenders, individuals who have offended against adults. And again, that could be like revenge based or some hostility towards women to relieve boredom. So it's just really, really maladaptive coping strategies. We see a lot of sexist coping as well. And a lot of it can be deemed from like sexually explicit materials, such as pornography. We did see a rise in individuals viewing child sexual abuse material during COVID because people were alone. So to relieve that boredom, they use sex as coping, and it is that slippery slope down to more taboo images.
So let me throw out a possible profile, and you tell me if this is one of the hundreds of profiles that you might run into, to illustrate for the listeners what you might be describing. So you will have an adult man who doesn't have a compulsion or an impulse, a paraphilia towards sadism, towards rape, towards children, towards exploitation. He's within normal range when it comes to sexual preferences. Maybe he went through a difficult childhood on some level, maybe abuse, maybe neglect, something along those lines. And he's functioning okay as a 35-year-old working fella. And his relationships, though, are not going so well. He gets divorced. His children might not like him very much. He's estranged from friends and family. Pandemic hits, and he doesn't even really know his emotions very well. He doesn't even know that he's struggling, that he's lonely, and he's just, working hard, trying to build for a future. And meanwhile, at night, he's drinking a lot of alcohol, smoking a lot of pot, and going on the internet and maybe getting riled up by politics or something. And he has all these needs on the inside of sexuality and closeness and attachment and fulfillment and self-esteem. But all of it's completely unknown to him because he was never given a chance to learn those things about himself. And he starts to look for some way to vent his feelings or to feel something or to feel connected to someone. And he starts to find himself going down this road where he starts to look at depictions of exploitation of other people. Maybe he feels powerless in his life. Maybe he was made to feel powerless when he was young. Maybe he even felt powerless about his body and sexuality when he was young. And so he starts to feel a little bit of relief when he watches pornography involving exploitation of women and of harsh treatment of women. Maybe it starts with consensual BDSM depictions at first, but leads him down this road of actually seeking material online that is either borderlining on depicting actual rape or even dark web stuff of actual crimes being committed. He finds that it fulfills him. It makes him feel something. It makes him feel powerful temporarily. There's a sexual gratification to it. Something he never really had dipped into before. It wasn't, 35 years old. All of a sudden he's watching this, micro niche of porn but he's isolated and, he justifies it to, it's just pornography. It's just stuff on the internet. Everyone looks at it. But eventually that's not enough. And then he starts to think about actually harming actual human beings. So he might engage in sex workers. And at first it's consensual sex work activity. But then eventually he's trying to seek that sexist, misogynistic, overpowering feeling because he's chasing the dragon, as they say, and he's trying to get that rush and that feeling of powerfulness, and then he starts to actually offend. Is this one of several hundred profiles that you might find?
Yeah, definitely, absolutely. That initial piece, there's like that participating event where he went through the divorce. He's not feeling attached. His children hate him. His friends don't really like him, and then he is kind of getting into that. And we know with like pornography, there's huge debates in my field, especially about pornography and is it healthy, is it not? But the pornography he was watching, especially if he did not have like a good like sexual education growing up, or if he wasn't getting a lot of sexual satisfaction with his wife, then that could lead him to be like, oh, this is what women want, this is normal. And it's becoming this like more normalized thing for him. So that could definitely be something that we could see.
And so then he starts committing crimes and starts harming adults. Maybe it starts with sex workers. Is that a common path, is starting with offending against sex workers?
In my experience, individuals who engage in like violent sex work and things like that, what I see with them is that the sex workers progressively get younger. And then that's when they get involved in like those sting operations. And it's 15, 16-year-old kinds of individuals, but typically not a lot of like, engaging in like problematic behaviors with sex workers. And then moving on to people, it's more sexual preoccupation and sex is coping for sex work and younger.
Okay. And so might this fictional individual that I laid out, might they start online dating, Tinder, this sort of thing, and then they just want to date, but then eventually one thing leads to another, they get drunk and they rape someone?
Mm-hmm.
Yeah.
I could see that. Like, yeah, especially if like the woman isn't giving them like that attachment or connection that they perceive that they need, or that maybe a parent consents. Because especially, again, if there was like poor education around what consent is when it comes to sexual behaviors, and like the huge rise of online dating and people's perceived notions of different apps and things like that.
It almost seems like you're saying a lot of the perpetrators, if they just had good attachments, secure attachments with people, they wouldn't offend.
I think that like that's one of the motivating factors is just those intimacy deficits. And I would say the majority of the people I see, that is the main factor, just deficits in that. And also like the poor sexual education, those kinds of combined is what I see most often with my guys.
Wow. Well, I can see why Paula would want you to talk with me, because that's right up my alley. I don't know if I've ever heard, is that a mainstream point of view?
I think a lot of colleagues that I have would agree with that. Like, of course, there's tons of things. We have assessments, we have risk assessments that kind of speak to that. But again, it's really that like just not having proper attachment, not having sexual education that we see a lot in our field.
So when you say sex education, what exactly are you talking about?
So like sexual education by porn is something that we see a lot. They learned a lot by that, or just like not their parents, like not talking about it at all. We see a lot of guys who grew up like very religious or like in spiritual communities, like just having not been talked about. So it's seen as taboo, who engage in problematic sexual behaviors because they don't know what consent is. They don't know what, when somebody's saying yes or no, or along those lines too, just not being accepting of their own sexuality, being, especially with some of my older guys, like it wasn't okay for them to be gay. So they took more opportunistic behaviors and were engaging in sexual kinds of behaviors with children. They're more vulnerable. So in order to get those needs met and that sexuality piece, to figure that out, they went that route because it just wasn't safe for them to be, or to tell anybody around them that they were gay.
Mm-hmm. For a bit, 10 plus years, I was in charge of sexual education at a junior high school in the area, and learned over time that there were a lot of barriers to creating a program that is comprehensive and actually helpful to young people. Of course, it was always age appropriate and this sort of thing, but the teachers, the parents, the district politicians, I found there to be a fair amount of barriers. I would have thought in the beginning that it was mainly the parents that would step in the way, but there were a few that I would have to have conversations with, but it was mainly the teachers in my experience who were paranoid about having parents hate them. Because I was an outsider, as an outside psychologist, being contracted to come in and teach the class. And the teachers, I think, had this point of view of just like, well, if we talk about, so what it came down to was the section on STIs and on abstinence, all that didn't really cause any anxiety for the teachers. But when I started to get into decision making and body positivity and that, the reasons why people have sex anyway, why do people want to have sex? Why do people enjoy having, what does a mutually fulfilling consensual sexual relationship look like, even for teenagers, right? We all understand that happens, but somehow just bringing up that topic is somehow terrifying for people. Yeah. And when every once in a while, I would get the teachers on board with that, but pretty quickly, the next year or the year after that, they would retract and, no, you got to get rid of that whole segment, And so there were some years where all I did was talk about STIs and how sex is going to kill you, okay? That kind of thing. So how would you like to change things for young people?
Yeah, I definitely think kind of that mutual, like showing like, why do we want sex? What is like what you were saying, I think would be great for us to have in like systems like that consent. That it's not only verbal, that it's body language, like who can consent, who can't consent, just like normal, like prepubescent, postpubescent sexual like behaviors. We're born sexual beings. Prepubescent looks like sexual exploration, but to somebody who's not necessarily didn't get that education, that can look like a sexually reactive behavior. So then they're more likely to engage in sexual behavior with that prepubescent child. So I think just like really educating them on like what is healthy and unhealthy kinds of sexual development is great. And again, that consent piece, and that'd be great. But again, I feel like a lot of these like more like younger generations are learning a lot from porn because it's so readily available. And because schools, it sounds like there is a lot of red tape about what can and can't be taught.
Yeah, particularly in some communities. I mean, Seattle is pretty liberal about these things. Imagine being in an abstinence-only community where it's illegal to teach anything other than that. So pornography, if you could wave a magic wand and change pornography, what would you do?
Oh man, it's so tough. Obviously, I feel like there are some people who enjoy doing that kind of work, but there's like, it's creating these like weird neural pathways in our brain, but at least like showing consent in the beginning would be great. That would be amazing. I think there's like this false expectations with pornography that sex just happens just wherever, but like showing what consent is, showing what it looks like, discussing sexual likes and dislikes, having that communication, which might sound cheesy to folks. And of course, people might not watch it as much, but at least it's educating them appropriately about like what a sexual relationship looks like, and then engaging in the acts that they talked about. But I don't think that would ever happen.
So if we were able to, you and I, if we were able to change our society and raise awareness about attachment, increase sexual education, change sexual education in a way that is conducive to human life, help people know their needs, have more resources so that people can reach out without worrying about being locked up, this kind of thing. But even just more generally about attachment needs, that people would know there's something going on with me. I'm lonely. It's a pandemic. I'm divorced and I have needs that I need to pay attention to, and I have an avenue to get those needs. But if we could really change all that, what percentage of sexual offenders would not go down a road of offending?
I would say a lot, quite more than half. I would say definitely.
Like 60, 70, 80%? What do you think?
I would say about 65%.
Okay. And then the other, what's the root cause of their offending?
Well, those could definitely be more of those more like intense, like paraphilic kind of things, like who struggle with being able to manage those, like the more pedophilic, for diagnostic criteria, pedophilic, voyeurism, exhibitionism, those kinds of things would need to be worked on in a different way, maybe more hostility towards women, but again, that could be worked on with attachment as well. So more of those paraphilic. And then, of course, individuals who have psychopathic traits, it'd be a much different approach than attachment and sexual education.
Mm-hmm. Right. So for those folks, it's a compulsion that they have. They might only be attracted to children. They might only have sexual arousal when they are exposing themselves in public. They might only get sexual gratification if the individual is unwilling, for example. And there are certain famous cases, allegedly, people like Armie Hammer, Harvey Weinstein, Bill Cosby, these individuals, especially I guess all three of them, it's not like they couldn't find partners to have sex with, and yet they still would turn to actions and allegedly behaviors in which they were in power, that they were harming the other target. The victim didn't want to do any of those things. It was very clear. Mm-hmm. So the theory is that these individuals have a compulsion to do these kinds of things. They want to harm other people. They get pleasure from harming other people, or they feel compelled, sort of an itch that they need to itch over time. And then when you add in those kinds of compulsions with psychopathy, lack of empathy, not caring about what other people think, there's a different treatment regimen for these individuals. Correct me if I'm wrong, but for the paraphilias, it's a matter of almost like an addiction model, right? Maintaining sobriety, so to speak. They have to have a sponsor, or they have to be thinking about it. They have to avoid doing things that will lead them down that road, Is that the model for those kinds of problems?
Yeah, it's definitely more behavioral in nature. And we do some like arousal management techniques as well. So it's more along those lines than like delving into emotions and intimacy and things like that.
Mm-hmm. So these individuals could have attachments that are working well in their life. Their life could be going okay. They could be okay when it comes to substances, but maybe the model is they were born with a compulsion, or they developed a compulsion at some point.
Yeah.
So you said arousal management? What does that entail?
So kind of identifying their more like problematic scripts, like, okay, so is this something like if I fantasize about this, or if I think about this, where am I likely to lead? And like having that tied to like, it used to be like they would sniff ammonia whenever they felt like most aroused when they were writing these scripts. Now we're trying to make it more trauma informed and body based. So like thinking of negative like consequences, or negative like body, like thinking about things that might make them want to puke, or fear based kind of like what's going to cause you like fear when you think about this. So tying those things in, we're kind of like, it's still in development for better ways to do arousal management that isn't so bad.
Right. So the model is essentially trying to create different neurological pathways that mm-hmm. involve an interrupt, or at least a negative association with the fantasy or the behavior or the imagined behavior, such that the individual won't get aroused after doing that regimen over time. Is that the idea?
Yep, exactly.
Is there ever an effort to help them be aroused by, because some people, they are only aroused by that criminal act. Are there attempts to help them to become aroused with actions and behaviors and activities that are not criminal, that are consensual and okay for everybody?
Mm-hmm. So then we'll kind of, so in order to fit more into those societal norms, absolutely. So there's like, they'll create like masturbation boards and things which feel more healthier. They find themselves actually starting to get aroused to, that are healthier for them and aren't illegal in nature. So those are the kinds of things, like kind of replacing it with a healthy fantasy where they are showing arousal is the goal.
So trying to associate arousal, physiological arousal with imagery and fantasy or behaviors that are not criminal.
Yes.
Yeah. Does that work?
I would say like in some of my guys, like some of will continue, like it'll be still part of them, but the goal is to make it not like the main thing that they get aroused to. So if we're able to put anything in that's not problematic or illegal and they actually are working, then they'll successfully discharge from treatment. And it does work the majority of the time, especially now that I feel like the way people are doing it, the treatment is more trauma informed. I feel like it's working a lot better.
What do you mean? What part of it has to be trauma informed?
Like less with like that ammonia and like calling him like making it so they have to like have these like huge logs and these sexuality scripts and like just saying this behavior is bad or immoral. So like they're having these like schemas or these like core beliefs that, oh, I'm a monster, I'm bad, right? And that's kind of as well like why the field's trying to get away from using sex offender and using more like individuals who've committed sexual offenses. Because if you put those labels on yourself, you're not kind of working with rehabilitation or treatment or things like that. So really trying to get away. Treatment used to be very punitive. So it's more about like actually working about like what are the motivating factors? What are the dynamic risk factors? Again, going back to that attachment, emotional regulation, problem solving skills. These are all things that we're working on.
Right. Because most of these individuals are not psychopaths. they do have empathy for other human beings. They don't want to harm others. And so if we can tap into that, they have an internal motivation. We don't have to shame them to care about other human beings. They already do, and we just have to help them to get out of the shame spiral that they have internalized from society or from their early childhood trauma that cause them to turtle and avoid and take their anger out on other people, that kind of thing.
Yeah.
So what do you think about the sex offender registry?
I feel like there's, at least in Oregon, there are good like changes happening. So I also do what's called like sex offense notification level like assessments. So these are for individuals who it's child sex abuse material, women, or juveniles. So I do assessments on those kinds of 3 offenses. And then I'm starting now also to get promoting prostitution assessments as well. So these 4 areas we're really working on with the registry to put them at a lower level so they can file for relief off the registry after 5 or 10 years. Because as we know, women and juveniles are one of the least likely, definitely least likely to reoffend when it comes to sexual offenses. Promoting prostitution doesn't necessarily mean it was a sexual intent behind these acts. It's typically monetary when it comes to these things. And it's very rare that it was sexually motivated. So trying to kind of get them off the registry. And then child sexual abuse material, gentlemen, also are lower recidivism rates with a very low likely to have hands-on behavior. So really working on getting them off the registry and like leveling them appropriately. So there's 3 tiers in Oregon, constantly kind of changing the policies around the registry and what the registry is actually being used for.
So is there any good to the registry?
I don't know. I think it could be, definitely. There can be in regards to like certain jobs or apartments and things like that. But we're also making it very, very difficult for these guys to get out and have stable lives, create stable attachments because they have to be registered. We're doing them like a disservice of them fixing or not fixing, but like working on any of these factors that led them to offend. We're putting them back in that kind of space because they can't get a job, they can't find housing, and they have to like live with individuals who have maybe committed more violent offenses or things like that. So the registry, I could talk forever about the registry.
Well, what else? What else would you say?
Just like, even like when it comes to like more like violent crimes, like sure, they can be on the registry, but like who are we trying to like tell who's looking at the registry? It just needs a lot of work, which they're slowly doing. So that's good.
Is there a rare individual that you work with where the registry might actually be an overall good? Maybe someone that is sadistic and psychopathic and hasn't shown any intent on changing their patterns and their behavior?
Yeah, I do. I have 2 that I feel definitely the registry, I think, is helping them kind of keep tabs like in regard to like management in the community. It just kind of helps them every year. Of course, they have to check in. And I also, another thing about the registry, like most of the guys who come back and see me is because they failure to register. It had nothing to do with like a sexual offense or sexually motivated behavior. That is what we see most often come back or be re-referred back to us, is because they failed to register. So it's just like a weird kind of thing there. But yes, there are some individuals, very, very few individuals where the registry is actually helping with safety.
So these individuals, sadistic, psychopathic, uninterested in changing, they might act like they're changing when they're not actually changing. What percentage of your clients fit that profile?
I out of my agency, I'm the only one who really works with them, and I have 2, so maybe 1%.
Okay.
Very, very rare. And again, sometimes sex offense specific treatment, especially with somebody who has more psychopathic tendencies, sex offense treatment might not be the best fit for them. They might not be amenable because we are teaching about sexual or emotional regulation or distress tolerance. And we don't want to teach people who have higher psychopathic traits to regulate their emotions anymore. So there are some, and it's more these individuals. It's more for containment kind of purposes. I'm seeing them every week. We're discussing their things. They're polygraphed in the state of Oregon at a higher rate as well, which there can be discussion about polygraphs as well. So that's kind of what I see.
Meaning that by law, they have to submit themselves to a polygraph as to whether or not they intend on harming or they have harmed off the record, so to speak, when they're released in the community. Have you offended in the last week? Those kinds of questions. They have to submit to that. Otherwise, they have to go back to incarceration, right?
Mm-hmm.
Yeah.
And in the state of Oregon, they love a polygraph still.
Yeah. So it's interesting because most people, I find, assume that 1% is 100%. All of the people you work with are sadistic psychopaths that are lost causes. How do you feel about that?
It's unfortunate that is like kind of like what is perceived to be a sexual offender, because that's also doing harm in their own home if they don't know what to watch out for as well. Because again, most of the things are happening in your own home. So if that's your perception, then you're not going to be mindful of grooming like these things, or even with your teenager, if they're engaging in like maybe some more sexually reactive behavior, you might not be as mindful for that because you're busy looking for strangers or men who look a certain way. So it's unfortunate that that's still kind of what people are thinking of when they think of individuals who commit sexual offenses.
Mm-hmm. Yeah. And you're saying it's upper 90% of the people who will offend fit a profile of someone who, with enough treatment, with enough prevention, would absolutely never commit one of these crimes.
Yeah, I think there was a research study, a meta-analysis, or a longitudinal study done in 2017, where 10 to 15 years, like after they were out in the community, they went through treatment, there was no recidivism with I believe it was 1,400 individuals. And again, I think there was another study done in 2020 that shows a much lower recidivism rate of individuals who've gone through treatment, especially the more like violent or high risk ones. So it was like 4 to 17% recidivism rate as compared to untreated high risk individual guy where it was 10 to 42%. So treatment can definitely, because it's just touching on those like motivating factors. And especially now we're really trying to follow the model of like risk, need, responsivity. We really are trying to follow this model. Like, what do they actually need? How can we respond to that in a very therapeutic way?
Do you find that so for that 65% of people that you work with, where it's mainly attachment based, after the fact, when they look back on their behavior, are they just aghast as to how they went down?
Yeah, I think I would raise it up to 70% after thinking through it more. But initially, these guys also come in saying, I cannot believe this was me. I can't believe I did this. I don't know why I did this. And like one of the biggest reasons, even though they're mandated for treatment, they do want to come to treatment because they also want to know like why, how could I have engaged in that behavior? And there is a lot, like you mentioned, shame. There's so much shame around it, which is unfortunate because we don't want to live in shame. That can be even more risky if we're in that shame spiral. So really trying to work on that with them. And a lot of the times they just don't know why. So
just get an idea of the sort of crimes that are committed, the people that you work with in that 70% group. Is it date rape? Is it rape of a partner? What sort of crimes are they committing or what are they reporting?
Mm-hmm. So the majority of my individuals, it's like what would be the conviction is like sex abuse 1 or sex abuse 2. So not necessarily penetration, not necessarily like rape, but just like sexually abusive behavior, like trying to engage in it, attempting to engage in these kinds of behaviors. A small portion of my caseload is more of that rape. So against that person's consent, but definitely more like just sexual abuse, like fingering or like oral sex or things like that. So what they would deem as sodomy.
Coercion,
we see coercion sometimes, especially with like 19, 20-year-olds, because like that statutory kinds of area where there is that apparent consent. So it's tough. And they usually get stuck with like the conviction of coercion and just discussing again what consent means in that case.
So these individuals, they're with someone that they're dating, or is it like someone they're not dating? It's usually someone they're dating.
Mm-hmm.
So they are in the beginning typically of the relationship, or are they years in?
Typically in the beginning.
So they are typically in the beginning of the relationship, and the victim will report that they were coerced or forced or afraid, or they didn't feel they could say no, or when they did say no, they weren't heard, and then they report these incidents, and then that's what leads these individuals to you.
Yeah.
Okay.
Yeah, definitely more in the beginning of a relationship.
Okay. Can you detect a psychopath when they enter treatment with you? Someone who is playing the game, they're manipulating you, they're trying to act like they're on board, because a true psychopath might say, oh, you're such a good therapist, and I'm learning how to not do this sort of thing. And of course I care about these people. And of course I would never want to do anything. You're right. And they play the game. And do you have a way of detecting those individuals?
When I first started, I got duped very hard by somebody with psychopathic traits. I really thought he was doing well in treatment, and he was doing some pretty deviant things. So like the reports that I'm writing were beautiful for him. But since then, I now am trained in psychopathic risk assessments. I've done these things because it is something that I see a lot more, because I do a lot more evaluation work than treatment now as well. So now I think I can hopefully, but it is still kind of tough sometimes. That's why consultation is always great, and being able to do these things and being able to read other reports to see if there is differing stories. I feel like I do a better job now. Do I feel like I'm amazing at it? No, because I am somebody who is very empathic and does have like rose-colored glasses in this field still. But it's very, very important, I think, for anybody in the field to kind of recognize these traits and recognize if somebody's being superficial or glib or things like that. But I think I do a much better job now.
If you were to have a better psychopathic detector radar, would that mean giving up empathy and care for all your clients?
No, I think it would just be like a different way to kind of approach assessments or things like that, or treatment especially. But yeah, no, I don't think I would ever give up empathy for my clients, because I would be doing them harm.
Do you have empathy for the psychopathic clients?
To an extent, as much as I can. I think that first one burned me pretty bad. So, but I definitely do have empathy for them, but only to the extent that I can for them. Yeah.
Yeah, I mean, I'll say that I have empathy of a certain sort for psychopathic individuals, clients included, because they don't wake up in the morning and say, I'm going to be a psychopath. It's not
Right.
It's not under their control. I don't have compassion, or I don't justify what they're doing to other people and the risks, of course, but the human. Does it take a special kind of person, and are you that special kind of person to be able to do this kind of work and have empathy?
I think it takes a lot of work on yourself, or like jumping into it, because you're going to be reading lots of police reports. There's a lot of training that kind of goes involved in like justice involved clients that doesn't necessarily have to do with your typical private practice clients or kiddos or things like that. So it is a totally kind of different field, where if you do want to give that positive regard to your clients, you're going to have to do self-work, especially if we do have a lot of survivors who are therapists in this field, because I feel like it does a little bit to that restorative justice piece, right? If you can see other people being healed, or like people who like your perpetrator be healed, then that's healing to you. But I definitely think it takes just work on yourself and a lot of training.
So if there was a burgeoning professional, a novice professional coming into the field, what advice would you have for them?
Always I think self-care in any aspect of like therapy work or anything like that, just making sure you're taking care of yourself, the burnout rate, and just like giving the clients, I think, especially if they want to be in this work, I think you have to want to be in forensic work to do it, but just really making sure they want to be doing this work, and that they'll give the clients a chance, and just really being up to date on all the research, because I feel like the field of sex offense treatment is constantly changing into a more trauma-informed kind of way, which is great and not so punitive, where we still have some of our risk assessments and some things like that are a little bit more punitive, and we need to update some of our stuff, but just always being up to date on research is important too.
So you're saying that before choosing this career, you really have to make sure that you're really into it, because it carries with it so many downsides that you really need the love of the field. You said forensic work, but I guess it's a particular kind of forensic work, right? You have to be really into it and get a lot of professional and personal satisfaction from the work to sustain yourself beyond the stress of the work. Is that what you're saying?
I think so. Yeah. You actually have to be really, really interested in this work. I have people who are like somewhat interested in it and try it out and then are gone.
I guess that's true for therapy in general, but maybe particular for this kind of work. Yeah. So what do you think it is about some people that would make them into this kind of work?
I don't know. Maybe they have experiences as a child. The vast majority, or higher than a half of my colleagues, are people who have survived sexual assaults. And again, I think that's really healing to them to kind of get that work, or they just I feel like over the past few years that we've had people like really like liking true crime stuff, and they kind of see this as a certain thing like profiling or something, which is not at all really what we're doing. So that's another thing as well, just trying to get it like a different kind of mindset around it. But I think maybe it's just their own personal experiences lead them to this field.
Meaning that there are people that are really into true crime and want to get into the field because they saw Mindhunter, the TV show or something, and they're more coming at it thinking that they're going to be able to catch the criminal or get into the mind of the deviant instead of actually providing empathetic, effective treatment.
I think, yeah, at first, I have had some interns who I supervised like kind of express that to me. But I think throughout, like, even if they have that interest, it does lend a better hand for them to like read the reports and like all these things. But I think there's some disappointment too, that that's not exactly what's going on. It's therapy. So
how much of the treatment, the therapy, percentage-wise, surrounds the offending? You know, like I'm getting the impression that, say, you're working with what's the typical length of therapy with these individuals?
Yeah. So typically treatment, we really are trying to like individualize it based on like risk level, like dosing it. Because there is also such thing as too much treatment. There's been tons of research that come out that too much treatment is going to be non-congruent to them not reoffending. But so there's this risk assessments called static and stable for hands-on offenders that we use that kinds of help us dose treatment. But typically we'll see guys for about a year to 2 years. I would say the majority of my guys are with me for 12 to 15 months. And the majority of our guys are in group treatment. And then I also have some individual clients based on like mental health, if their mental health symptoms are impacting them in a greater way, or high trauma, because I also do EMDR with these clients and things like that. But again, mostly group therapy. Dialectical behavioral therapy is what we do with them. So a lot of like emotional regulation, distress tolerance, social skills. And then we tie in kind of like healthy sexuality, healthy intimacy, and defense cycle. So there is a smaller portion than what like I think people think. We're not talking about the offense every session, all that. Maybe at the end of the module, it'll be like, okay, so in regard to like emotional regulation, how could have your skills been better at the time of your offending behavior than they are now? But the majority of treatment is really talked about the present. So maybe 25% is actually talking about the offense.
I imagine that a lot of your clients are overjoyed with the way that they're being treated, that they're not considered to be a monster, that they are considered to be inherently good individuals and treated like you might treat any client, that they deserve to feel good about themselves, they deserve to know their needs, they deserve to get their needs met, they deserve attachment, they deserve love, they deserve respect. What kind of reactions do you get from your clients?
Much different than the beginning, right? Because of course, like when they first come, they don't want to be there typically, or they do want to be there, but they're like kind of resisting because it's mandated. But like, I feel like inside, like in prisons or jails, I hear horror stories about like what sex offense treatment used to be or was. But I think when they get out, they're like, this is not at all what I thought. I'm doing so much better in my life now. I feel good about myself for the first time in ever. I feel like it's very, very beneficial for them. So it is always good to kind of hear that from them.
Yeah, I could see a lot of the individuals upon discharge would be better off than the average male in our society.
That's what they say. Yeah.
I mean, really, it's a horrible thing that we live in a society where someone has to be mandated to go to treatment so that they can learn about their attachment and emotional needs.
Yeah.
I don't know if you're aware, but there are these sting operations where people online, YouTube channels, influencers will specialize in baiting people to show up at a 7-Eleven. You know, they'll act like they're 13 and will suck someone in, and then they'll say, let's meet up at this place. And then when the person arrives at the location, they film them and say, you're a pedophile, shame on you, and let's call the cops. And they'll show their picture and try to get their name, and they'll publish this on the internet. Have you heard of such a thing?
Like they're just civilians doing that?
Yeah, civilians.
Like To Catch a Predator?
Exactly, yeah. What do you think about that? Or To Catch a Predator, what do you think about that?
They have a lot of time on their hands to be able to do this. Hopefully these people are be like, okay, here are the real, maybe to go to treatment instead of like stigmatizing it even more. But I mean, I can see why people would do that. They're just afraid for their children or their loved ones. But it's unfortunate that people are taking that upon themselves to do these things because it's just deepening the stigma and shame within that client, that individual. So
Well, thanks for coming on the podcast, Casey. My dogs are barking all of a sudden. I don't know why. I've learned a lot. I didn't realize that the field had progressed so far and coincides with the way I see things, or furthers the way I see things into an area that I don't often think about. So I'm really encouraged by that, because 10, 20, 25 years ago, the people that were in your field, they didn't, in my anecdotal experience, talk the way that you do, in a holistic understanding of human beings. And it's really quite encouraging. And I mean, when you think about not only the people you work with and getting the treatment that everyone deserves to get to some extent, but also the reduction in recidivism and crime, that you are on the front lines actually reducing child abuse and abuse to adults, victimization. I mean, just think about all the different people that have not been victimized, not been traumatized because of you and what your colleagues are doing.
Thank you. Yeah, no, it's been exciting to watch like the shift, because I came at the very end of like kind of the more punitive in the field and been these like more trauma informed. So it's been really great to see. But thank you for interviewing and being interested in the field too.
And so if you want to reach out to Casey, you can email her at casey@iceprogrampdx.com. So if you want to break that down, ICE, I'm guessing, is your agency name, which is what?
Innovative Counseling Enterprises.
Innovative Counseling Enterprises, so ICE program. And then PDX is, of course, the abbreviation for Portland. And everyone out there, please take care of yourself, because you deserve it. Well, Casey, why should people take care of themselves?
Because they do deserve it. Yeah.